disruptive in class. He almost never follows the teacher's directions. He often does not turn in his homework on time, and he is constantly distracting other kids with his jokes and stories. Jeffrey has a hard time focusing and staying organized because of how hyper his brain is. His locker is a mess, and his grades are nowhere near straight A's. Jeffrey's teacher is frustrated with him and worried about his education because she believes that Jeffrey might have some form of ADD or ADHD. Many children are diagnosed with one of these disorders because of their behavior falls outside of the expectations of society, often leading over to diagnosing, resulting in serious consequences. Teachers, parents, and doctors may all be too quick to recommend medication for children who appear overly excited or agitated. Any middle school boy with certain behavior problems. According to Gary Knoll, there is no place where there is more of a tendency to evaluate a child's behavior for possible links to ADD or ADHD than in school classrooms. Well-intentioned teachers and other school professionals assume that child must have ADD or ADHD when he or she does not easily comply with classroom expectations. Children behave in a myriad of ways. In addition, such students may be reflecting behaviors that result from learning disabilities, learning styles that are not compatible with the teacher's approach, boredom, or they may be simply acting out because of depression, circumstances at home, difficulty with relationships, or other factors, as stated on the National Institution of Health website. Education in some situations can be unindividualized, making it hard for children with ADD or ADHD to focus in class. Traditional classrooms where children are expected to sit down, be quiet, and do their work are very hard for kids who have hyperactive minds. The 7 learning styles are different methods teachers try to incorporate in their lesson plans to help children learn in the best fit way for them. Visual or spatial learners process information best using pictures and spatial understanding. Auditory learners learn best by talking out loud and using music. Verbal learners learn best by using words both in speech and writing. Physical or kinesthetic learners learn best by using hands and sense of touch. Many children with ADHD learn best in this way. Logical learners learn best by using logic, reasoning, and systems. Social learners learn best while in groups. Solitary or interpersonal learners learn best when given opportunities to work alone and discover new ideas. Many teachers incorporate as many varied styles into their lessons as possible, but there are still many teachers who rely primarily on lecturing and use of worksheets, according to Learning Styles Online. Symptoms of ADHD and ADD include inattention and/or hyperactivity and impulsivity. Many kids demonstrate these behaviors at some point in their lives, but this does not mean that every child who reflects these behaviors has a disorder. Often people in society have a perceived idea of how all children should behave. A child may be acting out or behaving oddly for a number of different reasons other than ADD or ADHD. Learning disabilities, for example, can cause children to become very frustrated with themselves when they see the rest of their classmates moving at a much faster pace. When a child is acting out in frustration because he cannot follow words on a page or cannot process what a teacher says, for example, he may actually be having a disability known as dyslexia or auditory processing problem and not have attention deficit disorder. Children mature at different rates, and that also may cause difficulties in diagnosing abnormalities, such as ADHD, ADD, or related psychological disorders in children. It is often difficult to know if there are serious problems or if children are simply reflecting differing rates of maturity. To establish a diagnosis of ADHD, the behaviors observed should be inappropriate for the child's age. There are no simple tests to determine whether a child has ADHD or ADD, so that causes diagnosis to sometimes be a method of trial and error, which can lead to misdiagnosis. When there are no set techniques in determining if a child actually has ADD, one would think that diagnosing and prescribing medication would be very cautious. But in fact, some school districts have more than 20% of their 5th grade boys on medication for such disorders, leading some to question whether overdiagnosis is taking place, according to the Oxford Journals. Many children with ADHD or ADD suffer depression, anxiety, drowsiness, and other debilitating side effects once they've begun taking prescribed medications. Often when children with ADHD, ADD, or related psychological disorders exhibit worsening symptoms, physicians tend to raise the dosage of medications to levels that are counterproductive, causing these side effects to be reflected more intensely. When debilitating side effects become pronounced, this may be an indication that the child needs a different kind of treatment. There are a variety of treatments for patients with ADD or ADHD. There are stimulant and non-stimulant drugs that have long lists of symptoms, but children are also offered many ways that they could avoid drugs, like therapy, in-school programs, and extracurriculars. There are in-school programs designed for children with learning disabilities that can also be beneficial for children with ADHD or ADD. Counseling or therapy may be helpful, or even encouraging children to be involved in appropriate extracurricular activities such as music, sports, or club activities, according to WebMD. Every individual is different and their brains function in different ways as well. Sometimes medication can be effective in improving a person's quality of life, but it can also be detrimental if the medication is not appropriate for that individual. Martha Grimes, a high school teacher in Michigan, has 2 adult children who have ADD. Catherine is an art history professor who has chosen to take medication for her ADD because it helps her focus and it helps her in many other aspects of her life. She loves studying the history of art because she finds it to be creative and stimulating. Joe, Martha's son, is an EMT who has chosen not to take medication because it causes him to feel lethargic and drowsy much of the time. His career requires a high level of energy and the ability to respond quickly and efficiently when responding to medical emergencies, which works well with his ADD. Joe is also married and has a baby, which proves that even without taking medication, those with ADD or ADHD can have fulfilling lives. Although medication can be beneficial for some, it is not needed treatment for everyone. Even though there are multiple ways to treat patients with ADD or ADHD, there are still problems because of researchers' lack of understanding about the human brain. Before there can be more efficient treatment of ADD or ADHD, medical researchers and childhood specialists need to gain more understanding about human behavior and brain function related to abnormal behavior in children before beginning or expanding treatment. The ADD-ADHD medication market continues to grow exponentially. The merger of 2 pharmaceutical companies, AbbVie Laboratories and Shire Pharmaceuticals, caused the newly combined company to become among the largest 50 companies in the world. Companies are making excessive amounts of money by selling medication aimed at children and adults with ADHD and ADD and related psychological disorders. At the annual American Psychiatric Association meeting, thousands of medical professors travel to evaluate and select the medications they will be prescribing to their patients. Many companies display big flashy signs, hire attractive drug representatives, and offer bribes such as fancy dinners, golf outings, tickets to sporting events, and many other enticing strategies in order to promote their drugs. Perhaps medical personnel can be deluded by more factors than just effectiveness of the medication, according to Huffington Post. Jeffrey could be diagnosed with ADD or ADHD, or he could be displaying certain behaviors for a list of reasons. If he is diagnosed with ADD or ADHD, he will have to deal with a load of stereotypes for the rest of his childhood and young adult life. He will be called misbehaved, unintelligent, lazy, and hyper for something that he simply cannot control. Jeffrey is like many other kids whose lives have been changed because of an ADHD diagnosis and medication that is meant to correct this diagnosis. Children are not perfect, and not even Ritalin can change that. There needs to be a more effective way to diagnose this condition and more alternative treatments to medication. Children who are believed to have ADD or ADHD should be thoroughly examined for learning disabilities and other problems that may initially look like ADD or ADHD before they are taken to doctors for a diagnosis. Changing the traditional expectations that are a part of the public school system could be a huge step in the right direction to solving this problem.